Hello everyone, how are you all? Today let's start Anatomy INICET 2024 paper. First question, which of the following is not seen on the floor of the inferior horn of lateral ventricle? This is something a difficult question, I would say, because you should have some visual memory. So let me show you the pictures, okay? This is the lateral ventricle. This is the third ventricle. And this is cerebral aqueduct and this is the fourth ventricle. Okay. The lateral ventricle has an anterior horn, central part of the lateral ventricle, and this is the posterior horn and this is the inferior horn. Now let me show you each horn. Okay. First is the anterior horn of the lateral ventricle and this one. Okay. Here in the roof, the corpus callosum will come. So the roof is formed by body of the corpus callosum. Whereas medial part, you can see the septum pellucidum. In the floor, you can see head of the caudate nucleus and also you can see the rostrum of corpus callosum. These are the posterior fibers, okay? The rostrum of the corpus callosum. So in the roof also you can see corpus callosum, which comes like this, isn't it? So in the floor also you can see corpus callosum, rostrum of the corpus callosum. Okay, this is the visual memory you should have. Okay, now coming to the central part, this part. Okay, here also the roof is formed by trunk of the corpus callosum. Okay, this is the trunk, that is body of the corpus callosum. Like this, corpus callosum will come, body of the corpus callosum forms a roof. Whereas medial wall is formed by, again, septum pellucidum. Here also medial wall is formed by septum pellucidum. Okay, whereas floor is formed by, this is the caudate nucleus, that basal ganglia, you know, right? That caudate nucleus, and here you have a stria terminalis, and here thalamostriate vein will come. Okay, then this is the thalamus. Okay, this all forms a floor of the central part of lateral ventricle. Okay, now coming to the posterior horn. Okay, this is the posterior horn. Let's see. Here the roof and also the lateral wall is formed by tapetum. Tapetum is a part of corpus callosum. Okay. Whereas this medial wall is formed by forceps major. And also medial wall is formed by this sulcus, that is calcarine sulcus, which forms a deep, that is called as calcar avis. Okay, this two forms a medial wall, that is forceps major, which is a part of corpus callosum, and also this calcar avis. And this is the question they have asked, that is inferior horn of the lateral ventricle. First, let's see roof and the lateral wall. Roof and the lateral wall is formed by stria terminalis. In the central part also you can see stria terminalis here, isn't it? In the roof you can see tail of the caudate nucleus. The tail will come here, so it is also forming a roof. Tail of the caudate nucleus forms a roof of the inferior horn of the lateral ventricle, and also the tapetum of corpus callosum. Okay, whereas the floor is formed by, here there is a fimbria of fornix and hippocampus, you can see, and this is the collateral eminence, which is formed by the collateral sulcus. Okay, now let's see the question again. Not seen in the floor of inferior horn. Do you have the visual memory? Okay, fimbriae, yes, I have showed like this one snake type, isn't it? Here the fimbria will come, fimbria of the fornix, yes, it forms. And next, the collateral eminence, yes, we saw. It is formed by the collateral sulcus, isn't it? Yes. Hippocampus, yes, you can see near the fimbriae of the cortex, yes. The tail of the caudate nucleus is not forming the floor. It forms a roof of the inferior horn of lateral ventricle. Hence, this is not forming a floor. Okay. Second question. The area marked by the arrow is supplied by which of the following arteries? Here you can see this is the interventricular septum, isn't it? These are the ventricles and this is the septum. Interventricular septum obviously supplied by interventricular artery, and this is by the anterior interventricular artery, which is a branch of left coronary artery. Let me show you the picture. See, this is the aortic sinus, this is anterior, this is left aortic sinus, and this is right aortic sinus. Left coronary artery gives two branches. First, that is left circumflex artery and left anterior descending artery, which is also known as anterior interventricular artery. Okay, this supplies anterior interventricular septum. Okay, here another branch will come, that diagonal branch, that is supplying left ventricle, and this marginal branch also supplies left ventricle, whereas circumflex artery supplies left atrium and also left ventricle, and it will go backwards. Okay, and here from the anterior aortic sinus you get a right coronary artery, and it will arch backwards, and also it is same continuing as a right coronary artery. In the anterior part it gives one marginal branch which supplies right ventricle and also apex of the heart. Okay, whereas this is the posterior interventricular artery. Sometimes it is arising from a right coronary artery, sometimes it will arise from a left circumflex artery. Okay, when it's arising from a right coronary artery, it is called as a right dominant heart, whereas if it is comes from a left side, left circumflex artery, then it is called as left dominant heart. Okay, here it will anastomose with this left anterior descending artery. This posterior interventricular artery supplies posterior interventricular septum. Okay, here you can see the major blood supply of the conduction system, that is SA node, AV node and bundle of his is supplied by right coronary artery, whereas right bundle branch and left bundle branch is supplied by left coronary artery. This was actually a repeated question but the twisted PYQ. So blood supply of heart is important question. Okay, so here answer is C. Third one, the professor underwent a left parathyroidectomy. The post-surgery, she complains of left lower lip paralysis. Which structure is involved? The facial nerve is present near the parotid gland. Okay, here they have given almost 3 options are about all facial nerve only, but this D is parotid duct. No, parotid duct injury will not cause any paralysis of the lower lip. Okay, so it should be A, B, C. Either it should be either of this A, B, C. Okay, this injury to the main trunk, that means everything should be paralyzed, not only left lower lip paralysis. Okay, so this is also ruled out because no other symptoms they have given. They have given only one symptoms, that is left lower lip paralysis. Whereas facial nerve, cervical branch, yes, might be. Let's see the picture once. See, facial nerve gives a 5 terminal branches here. Okay, it's giving a cervical branch, and this is the mandibular branch. This is the lower buccal branch and upper buccal branch. This is the zygomatic branch, and this is the temporal branch. Okay, this temporal branch they have given in the option, which supplies frontalis muscle and auricular muscle and orbicularis oculi. So they have not given any symptoms related to orbicularis oculi or a frontalis muscle, isn't it? So this is not injured. Whereas orbicularis oculi is lower eyelid part is supplied by zygomatic branch. This is also not given in the option. Buccal branch supplies the muscles of the cheek and upper lip, whereas mandibular branch supplies muscles of lower lip. But they have not given mandibular branch in the options. So we have to choose which is appropriate answer in this question. Actually, the temporal branch we have ruled out. Facial main trunk is also ruled out because they have not given any of the other symptoms. Then the remaining is cervical branch, which supplies platysma. So you can relate this. The platysma is also helps in the movement of the lower lip. Okay. When there is damage to the cervical branch, there is a paralysis of the lower lip. Hence, you can relate cervical branch to the paralysis of lower lip. Okay. Option is B by ruling out A, C, and D. Okay. Okay. Let's coming to the fourth one. The 60-year-old male recovering from facial nerve palsy complains of food getting stuck between the cheek and teeth while eating. What is the muscle affected in this case? He has a facial nerve palsy. Okay. Now he is getting recovered from the facial nerve palsy. But the question says food gets stuck between the cheek. That means something related to the cheek muscle got paralyzed. So the food is not pushing against the teeth, or hence there is a food which directly comes and stuck in between the cheek and teeth. Okay, this is by buccinator muscle. Let me show you the explanation. The buccinator muscle is responsible for keeping the food between the teeth during mastication by pressing the cheek against the teeth. Okay, that is flattening of the cheek against the gum and teeth. The patient of palsy of buccinator muscle will cause the food accumulates in the cheek pouch as the muscle is unable to contract properly. Okay, if it contracts nicely, then food will not stuck between the cheek and teeth. But if it is paralyzed, then the food will get accumulated. Okay, because of unable to contract properly. The levator labii superioris elevates the upper lip and contribute for facial expression, showing the teeth and dilating nostrils. Okay, whereas zygomaticus major pulling the corner of the mouth upward and outward helps in smiling. Okay, orbicularis oris encircles the mouth and helps in closing the lips, helps in mastication and speech. Okay, buccinator is the main muscle for food lodging. Okay, hence option is A. Coming to the fifth one, the cranial part of neural crest cells leads to the formation of. Okay, here we have to see which of the following part is derived from neural crest cells. We have discussed about neural crest cells derivatives in our previous questions also. Let's see the derivatives. The most of the structures you can remember by PNS structure, peripheral nervous system structures, that is all ganglions, enteric plexus, sympathetic chain, and parafollicular C cells, okay, Schwann cells. And other two are melanocytes, or melanoblast, adrenal medulla. Whereas head and neck derivatives, that is craniofacial, skeleton, dentine, odontoblast, and pharyngeal arch cartilages, dermis of head and neck. Here, conotruncal septum of the heart, that is aortopulmonary septum. Okay, the smooth muscles of the blood vessels, ascending aorta, pulmonary trunk, and coronary artery. Most of the smooth muscles. Okay, and ciliary muscles in the eyes also derived from the neural crest cells. Okay, heart, we can see in the third week of embryogenesis, that developed from cardiogenic mesoderm. Heart tube forms through the fusion of paired endocardial tube. Okay, that is bulbous cordis. You can see SA node is from sinus venosum. AV cushion is from adjacent endocardial cells, and chorda tendineae is from mesenchymal tissue within the heart. Okay, here the option is conotruncal septum. If you know the exception, that is everything of the heart is derived from endocardial tube, that is the mesodermal origin, but only exception is conotruncal septum. So if you remember conotruncal septum is the exception, it's easy, isn't it? Yes. Sixth one, which of the following joint is not formed by the structure shown in the picture? They have given a vertebra. Okay, these are the articulating surface. Which of the following joint is not formed through this articulating surface? Okay, let's see the explanation. These questions actually you have to read during the 10 days before exam also. Okay, so the image is showing a thoracic vertebra, the vertebral bone participating all this joints. Okay, it forms an intervertebral joint, that is secondary cartilaginous joint. Okay, you have to remember this. That is also called as symphysis type. Okay, here the cartilaginous joint is divided into primary cartilaginous and secondary cartilaginous. They are telling that intervertebral joint is a secondary cartilaginous joint, that is symphysis joint. Okay, between the two vertebrae. Okay, next costovertebral joint is plain synovial joint, whereas costotransverse joint is a plain synovial joint. Both are synovial joint, that is between the costo is what? It is a rib, whereas vertebra and the transverse joint is also a plain synovial joint, whereas the facet joint or a zygapophyseal joint is also a synovial joint. See, the vertebra that connected by anterior and posterior ligaments. Okay, these vertebrae are connected by the ligaments, anterior and posterior ligaments, that are nothing but between two bones connected by ligaments and the strong membrane. This forms a syndesmosis. Okay, you can see syndesmosis, which is also present in radio-ulnar joint, middle part. Okay, here like this. That is like something membrane, strong membrane. This is also present in the vertebra. But only which is not present, that is primary cartilaginous joint, that is synchondrosis, which is present in the rib only, where in between the costochondral junction. Okay, in the anterior part it is present. It is not present in the vertebra. That thing you have to remember. Okay, then everything is present in the vertebral bone, which participates in all the type of almost all these joints. Only exception is synchondrosis. Okay, see, synchondrosis is an example of costochondral joint that is formed between ribs and costal cartilage. Okay, this is the rib. If you see the picture of rib, you will understand that is costochondral junction. Okay, that is the primary cartilaginous joint. Which is the example of secondary cartilaginous joint? It is intervertebral joint. Okay, you have to remember primary cartilaginous. It is given a primary, right? So it is given more importance for C. Primary cartilaginous chondrosis, synchondrosis. Okay, secondary cartilaginous is not given so much importance, so it is just a symphysis. Okay, syndesmosis is for something dense. You can remember dense, desmo, like that. It's a dense membrane. Okay, that is strong membrane. Okay, so here which is not a form, that is synchondrosis. Synchondrosis is a primary cartilaginous joint which is given more importance. I told you, isn't it? Primary cartilaginous is given a more importance, that is chondrosis, cartilage chondrosis. So this is not present in the vertebra. All these three are present in the vertebral joints. Okay. Okay. Today I have taught different topics. So once go through these topics, it will be very easy and revisable. Okay. Thank you.